I am Dr. Suryanarayana Sharma. I am a senior consultant neurologist and stroke specialist at Apollo Hospitals, Bannerghatta Road, Bangalore. Today, let's know something about stroke. Basically, stroke is a disease of the brain. It occurs when there is a occlusion with the clot, or there is a rupture of the blood vessel which supplies the brain. If there is a occlusion because of a clot, we call it as ischemic stroke. If there is a rupture of blood vessel in the brain, that is called as hemorrhagic stroke. So globally, around 15 to 17 million people are suffering from stroke every year, and around 50 lakh people are dying because of stroke every year. So stroke is considered as a global health emergency. Unfortunately, out of many neurological diseases, stroke has maximum superstition. So even now, a lot of people go to alternative forms of therapy where there is no documented or evidence-based efficacy. So whenever there is a acute stroke, the time is important. It's a time-sensitive treatment. First 4.5 hours of acute stroke is called golden hour, wherein if the patient reaches the hospital in time, we can start the therapy and patient can be better. So there is a persistent need to raise awareness about acute stroke in the public. When the patient has a stroke, many a time he may not be aware that what is happening with him. So it is the responsibility of the neighbors or the family members or the colleagues in the office to identify the stroke symptom. To make it very simple, we call it as be fast, BE-fast. Remember, be fast. B stands for balance. If there is a sudden loss of balance, or E stands for eye signs. If the patient complains of sudden onset blurring of vision, sudden onset visual loss or double vision, so it may reflect that patient may have a stroke. Then F stands for facial deviation. The angle of the mouth may be deviated to one side. Then A stands for arm drift. Patient may have total paralysis of the hand or leg, or if there is a mild weakness, you ask the patient to keep the hand like this. So if the patient is normal, he will hold it for at least 10 seconds normally. If there is a weakness, this hand drifts down like this. We call it as arm drift. So this is another feature. Then S means speech. Patient may have slurring of speech, patient have total loss of speech, or patient may be unable to comprehend what you are telling, or patient may utter grammatically incorrect sentences. And last, T stands for time to act, which means the moment you identify any of these symptoms, please go to the nearest stroke ready hospital. Stroke in young has increased enormously in the last 1 decade. In my own experience, I can say that almost 20% of the patients with acute stroke, they are less than 40 years of age. There are many reasons. The lifestyle, the diabetes, hypertension, the risk factors, other risk factors, sedentary lifestyle, smoking, obesity. Now we call sitting as new smoking. If somebody works for 10 to 12 hours sitting in his computer, that means without doing any exercise, that is like you are smoking 5 to 6 cigarettes per day. So these are all the risk factors which most of the youngsters tend to ignore. So over time this will build up and many patients may have complication. The lifestyle modification in acute stroke is very important. The stroke prevention, 90% of the stroke is preventable. Remember, it can happen only due to 5 or 6 major conditions: uncontrolled hypertension, uncontrolled diabetes, high cholesterol, heart problems, smoking, obesity, sedentary lifestyle, arrhythmias, that is atrial fibrillation and other heart diseases, the asymptomatic carotid disease. That means the carotid vessel is a large vessel in the neck which goes to the brain. If there is any blockage in that, the patient can have stroke. So to prevent that, have a good healthy diet, practice healthy lifestyle, at least have 150 high intensity minutes per week, which means daily at least 5 days a week you at least walk or run or jog at least 30 minutes. Do yoga, do pranayama, stop smoking. So these are all some of the tips wherein you can lead a healthy life, you can avoid getting a stroke. Thank you.